Hello friends, welcome back to Complete Medical Coding. Today let's discuss the CPC examination pattern. I have got few queries regarding the examination pattern, like what is the whether 4 hour duration, what it consists of, or what are those 100 questions includes, or how the pattern, how the questions be like. All this we will discuss here. Okay, so let's look into the examination pattern today. First, let's check what is the eligibility to write the CPC examination. Okay, I'm telling you, those who are not a part of life science or those who are not a part of science background can also learn CPC and can write the CPC examination as well. Okay, friends, this is for your knowledge. So, in order to sit for the CPC exam, you must meet the following requirements. So, these are the eligibility. Okay. Demonstrate proficiency in evaluation and management, anesthesia, surgery, radiology, pathology, and medicine. So, these are the chapters. Accordingly, you have to be proficient in all these chapters. Possess sound knowledge of medical coding guidelines and regulations, like for example, compliance and regulatory, everything, and each and every guidelines you should be knowing. Exhibit mastery of anatomy, physiology, and medical terminology necessary to code diagnosis and services. Again, you need to know the anatomy, physiology, terminology, everything. Medical terminology is everything. Okay. Understand how to integrate medical coding and payment policy changes into the reimbursement process. How to do reimbursement process, all those also you should be knowing. That I'll do a separate video for that. Okay. So you can meet these requirements through prior medical coding experience, okay, or an AAPC approved training program. So what we are doing, what I am providing you is the AAPC training program, AAPC approved training program, okay. So like that, there are many courses. If you can search in YouTube, you will be getting a lot of helpful videos as well. And there are institutes that provides medical coding training. You can go directly, you can do online as well as offline. Okay, so this is what the eligibility is. All right. Now, this is the outline, test outline. The CPC exam contains 100 multiple choice questions and you will be given 4 hours to complete it. The questions are split into 17 knowledge areas and one set of 10 cases. So the total hours duration is 4 hours and then 100 questions. This change has been made recently of 100 questions. Recently in the sense, I think almost for 2 years, I think. Before it was 150 questions. It was a set of 150 questions and the duration was 5 hours 40 minutes. When I did the CPC examination, that was the duration and that was the question. 150 questions, same multiple choice questions. Okay. And the duration was 5 hours 40 minutes. That was the time before. 10 questions from each chapters. It was like that. And then 5 questions from HICPICS. Now everything has been changed. They have made a little liberal. The examination pattern, the questions, the time, everything. So now it has been reduced to 100 questions, 100 multiple choice questions. And then they'll be giving 4 hours to complete it. And there are no negative marking. Okay. So let's discuss what that like chapter wise, how many questions you will be getting, or what type of series in each and every series, what type of questions you will be getting. That will be discussing. In the first one, 10,000 series CPT questions. It consists of 6 questions. You will be getting 6 questions from 10,000 series. Okay. The questions in this section cover surgical procedures performed on the integumentary system. 10,000 series means integumentary system, including skin, subcutaneous, nails, pilonidal cyst, repairs, destruction, and breast. So, among these topics, you will be getting 6 questions. something related to skin, subcutaneous tissue, nails, pilonidal cyst, repair, destruction and breast. Okay. Now when you move to 20,000 series, again 6 questions from 20,000 series. What is 20,000 series? Musculoskeletal system. So the questions in this section cover surgical procedures performed on the musculoskeletal system. There is nothing in detail mentioned. Okay, because you might be getting, it's a simple chapter as well. So you'll be getting like more common questions that I used to discuss now from musculoskeletal series. Only those questions. There is no particular point to learn from that. Now 30,000 series CPT questions. It consists of 6 questions. 30,000. The questions in this section focus on surgical procedures performed on the following: respiratory, cardiovascular, hemic, lymphatic, mediastinum and diaphragm. So all these: respiratory system, cardiovascular system, hemic system, lymphatic system, mediastinum and diaphragm. 40,000 series, again 6 questions. The questions in this section focus on your knowledge of surgical procedures performed on the digestive system. 40,000 series, 30,000 and 40,000 is important because you will be getting descriptive type case study questions from these two. Mainly from these two, you will be getting the case study questions. Okay, the big questions. Now 50,000 series, again 6 questions. The questions in this section will challenge your knowledge of surgical procedures performed on the following systems. What are the systems included in 50,000 series? Urinary system, male reproductive system, female reproductive system including maternity and delivery, and then endocrine system. So from here, the important one is, the important one is female reproductive system, maternity and delivery. That is more important here. Okay, you will be definitely getting some questions from that. Now 60,000 series consists of 6 questions. The questions in this section assess your knowledge of coding surgical procedures performed on the nervous system. Okay, that is common. There is nothing, no important points from that. Now evaluation management, there is another important section. Again 6 questions from that. The questions in this section assess your knowledge of proper coding related to place and level of services. Place of service, level of service. It also includes questions on coding for the following: preventative medicine, virtual services, neonatal and pediatric critical care, intensive care, prolonged services, chronic care, transitional care, case management, care plan oversight. These are the important points that you need to learn from E&M section. Now anesthesia. It is a simple one. Anesthesia, you will get only 4 questions from anesthesia, but it's very easy to score marks. Okay. The questions in this section assess your knowledge of the coding requirements for the following: time reporting, that is important. You will definitely get 1 question from time reporting, 1 question from qualifying circumstances, 1 question from physical status modifiers, and 1 question from anesthesia for surgical diagnostic and obstetric services. But it's easy to learn, easy to score marks as well. Okay. Another easy to score mark section is the radiology section. 6 questions from radiology section. It's very easy to score mark. In order to save time, you can directly go to radiology section when you get the question paper. Initially, you can finish it out. Okay, but be careful. Read each and everything carefully. You have to look mainly on the views, the number of views mentioned in the question as well as in the CPT description. That is very important. Okay. So radiology, the questions in this section focus on diagnostic and interventional radiology, if I told you. Now laboratory or pathology, again 6 questions from lab and pathology. That is also easy to learn. You can do radiology and pathology together. You can, like that, you can finish out the number of questions. You can save time. Okay. These are the things that you need to look out from lab and radiology. I'm not reading it because so many are mentioned. organ disease panels, many panels, okay, consultation, that is pathology consultation, okay, urinalysis, molecular pathology, chemistry, immunology, everything you need to learn. But it's easy, as I told you earlier. Now, medicine. Medicine section consists of 6 questions. The questions in this section cover multiple specialty specific coding scenarios. Medical terminology. Terminologies are important. Okay, medical terminology consists of 4 questions. The questions in this section assess your understanding of medical terminology for all systems. Okay, all body systems. Anatomy. Medical terminology is separate, anatomy is separate. Okay, from anatomy you will get 4 questions. For non-science students it will be little difficult, but if you have that, that eagerness, that courage to learn, definitely you can score marks from anatomy, because the questions from anatomy is little twisted. That's the reason. The questions in this section assess your knowledge of human anatomy for all systems. Now 5 questions from ICD. ICD 10 cm. Diagnosis from ICD, like direct ICD. Only ICD questions you will get 5 questions, okay. The questions in this section assess your proficiency in diagnosis for all chapters in the ICD 10 cm and your knowledge of the ICD 10 cm official guidelines for coding and reporting. This includes guidelines as well. Again, HICPICS level 2, you will get 3 questions. That's also very easy. You can finish it out in the beginning. The questions in this section focus on modifiers, supplies, medications, and professional services for Medicare patients. HICPICS. Now, coding guidelines, 7 questions. This also you can mark initially, because you don't have to refer any textbooks for coding guidelines. 7 questions you will be getting. The questions in this section assess your understanding and expertise of the ICD 10 cm official guidelines for coding and reporting, CPT coding guidelines, and parenthetical notes and modifier use. The last section, not last, second last, yeah, compliance and regulatory. 3 questions you will get from compliance and regulatory. The questions in this section evaluate your knowledge of compliance and regulations that pertain to the following. These are the important points that you need to learn from compliance and regulatory. What are those? Services covered under Medicare parts A, B, C, and D. Payment coding. Place of service reporting. Fraud and abuse. NCCI edits. NCD-LCD. HIPAA guidelines. Okay. ABLs. RVUs. So NCCI edits, I'll be taking a separate video for that. Apart from that, HIPAA, AB, and RVUs I have already done from compliance and regulatory section. And in the next video, again I will be coming back with questions from few practice questions from compliance and regulatory. Okay. Now 18th, the last one is cases. 10 questions you'll be getting from cases. 10 cases are presented to evaluate your ability to code medical record documentation accurately. These cases may also test your knowledge of medical terminology, anatomy, compliance, and regulatory information. These are the case questions which I had mentioned earlier. Mostly case questions you will be getting from respiratory and digestive system, like 30,000 and 40,000 series. So, like that, you will be getting a total of 10 case questions separately. Okay, but focus mainly on respiratory and digestive, 30,000 and 40,000 series. So, these are the examination pattern. Okay. So, friends, hope you understand. Hope you like the video. Freshers, you can prefer this video. You can share this, especially for the freshers I am telling. Those who are learning, like those who are beginning to learn medical coding, just share it among your friends. This will be very useful. Okay, at least they will be knowing how the examination pattern is, or what are the questions that it covers from each pattern, from each series. Okay. So friends, if you are new to the channel, please subscribe, please like and share my videos. And thank you so much for watching. And yeah, stay tuned. See you in the next episode. Bye. Take care.